Hi, Mary Gavoni here on Monday, June 14th, 2021. Happy Flag Day. Have you heard the news? There is a new OSHA standard in town, and there's lots of speculation about whether it affects dentistry or not. So what I'd like to do is just take a few minutes and explain what the standard is about and help you to take advantage of some tools to help you determine if the standard applies to you or not. So this OSHA standard, called the Emergency Temporary Standard, is an interim final rule that was released by OSHA at the direction of the Biden administration to protect workers from COVID transmissions in the workplace to enhance worker safety. Now, some of that may seem kind of redundant to most of us working in dentistry because we've already been doing so many things to keep us safe. And our transmission of COVID-19 in the workplace, in the dental workplace, is very, very low because we have been following guidelines. So what you need to know is, first of all, the standard has not taken effect yet. It's about to. It has to be published first in the Federal Register, and it becomes effective as of the date that it's published in the Federal Register, and that has not happened yet. Once it is published, 14 days from the date of publication, there are some criteria within the standard that must be met, must be in compliance with. And then within 30 days of the publication, then the rest of the criteria or the requirements in the standard must be met to be in compliance. Another thing to know is that within that 30 days of publication, any community of interest, any individual can make comments directly to OSHA about the interim standard, whether you like it or not, agree, disagree, whatever you would like to say about it, and up to and including whether you think that this should become a permanent standard, because that is one of the reasons why OSHA has made this an interim standard, because they're making the decision based on feedback whether it will become a permanent standard or not. So you can access all this information on the OSHA website, osha.gov, and search for Emergency Temporary Standard, or ETS. If you would like to have all the documents that are included in the standard in a quick and easy, convenient place to get them, you can visit my website, marygavoni.com, and I have everything uploaded that you can then access to help you know what is going on with this standard. One of the things that OSHA developed is a flow chart, or kind of like a decision tree, to help decide whether a workplace is covered by the standard. And most of the feedback we've received from the communities of interest, dental organizations and such, believe that the standard does not apply, which I agree with. However, what you need to do is look at the criteria in this decision tree to see if you meet the criteria to be exempt from the standard. So the first thing on the decision tree is whether or not you provide healthcare services. Well, of course you do. And so that immediately puts you into the next set of criteria, which has to do with whether you are an ambulatory care facility, a non-hospital ambulatory care facility, which you are. Ambulatory care facility simply means that healthcare services are being provided outside of a hospital setting. So many times people think of ambulatory care only being part of medicine, but it applies to any healthcare services not provided in a hospital. The next criteria to exempt you from the standard is that all non-employees are screened prior to entering your facility. Now, screening is something that we have done regularly because of the CDC guidance from when we reopened practices after the shutdown in the beginning of the pandemic. But many practices that I've talked to over the last several months have stopped screening patients, thinking it's not necessary anymore. People are vaccinated. The pandemic is winding down. Some people actually believe it's over, which it's not. And so if you are not currently screening your patients or anyone else who comes in your facility, then you don't meet the criteria for an exemption. Then the last of the criteria has to do with not providing any services or actually not allowing anyone with COVID symptoms or having a positive diagnosis of COVID-19 into your facility. So in order to be exempt, you would not be able to even provide emergency services for patients who you suspect have COVID or have been diagnosed with COVID-19. Those criteria have to be met. You're a non-hospital based ambulatory care setting. You screen all non-employees, so that means patients, it means delivery people, it means sales reps. Anyone who comes into your facility has to be screened, taking temperatures, asking questions about symptoms, and you then must not allow anyone suspected of COVID or been diagnosed with COVID in your facility. That's how you are exempt from this standard. So if you don't meet all of those criteria, then you have to comply with the standard. But the reality is that beyond the OSHA temporary standard, we are required to comply with all of the CDC guidance for healthcare settings and specifically for dentistry. In its guidance for enforcement of COVID safety in healthcare facilities or any workplace facility, OSHA states very clearly that employment settings must follow all applicable CDC guidance. So you must follow the CDC guidelines. Now, we haven't had an update for dentistry specifically since December of last year, but there was an update on April 27th for all healthcare settings. So there are a lot of things that apply to dentistry in that particular update. So if you look at the CDC documents, they have never stated that we should stop screening patients. They have never stated that we should no longer require patients to enter our facilities without a mask. That option of going into a facility without a mask, whether you're vaccinated or not, is for public settings, not healthcare settings. So I think there's been a lot of misunderstanding about that. So again, you must follow all the CDC guidance, and we do expect an update to the CDC guidance sometime within the next several weeks. We don't really know what it's going to say, but I think that buys you some time, again, to know if you don't comply, or excuse me, if you have to comply with the emergency temporary standard, how do those criteria work together with CDC guidance? So if you have any questions about this, you can contact me at mary@marygavoni.com. Go to my website, marygavoni.com, and I will have available for you not only the emergency temporary standard documents, but the current CDC documents from December 4th of last year and the April 27th CDC guidance for healthcare settings. So I hope this is helpful. I know things have been very confusing throughout this whole pandemic, and if you want more information and want to hear a little bit longer discussion about how this temporary standard affects dentistry, go to thecompliancedivas.com and sign up for our podcast. This week's podcast will be all about the emergency temporary standard, so I hope you'll join us.